We get a lot of athletes with pain in the back of their elbow coming down into this olecranon bone on either side. There's a few causes of posterior elbow pain, one of which is triceps tendonitis or breakdown of that triceps tendon as it kind of splits and grabs a hold of that ulna bone. But we can also get pain from the UCL, that ulnar collateral ligament, or even the ulnar nerve that come through that elbow. But the most common cause of posterior elbow pain is actually impingement in the back of the elbow, as you can see kind of occurring in this anatomical model where some of the capsular tissue or the ligament tissue in the back of the elbow can actually get pinched, or the bones compressed to an excessive amount on the back side of the elbow. We call that posterior elbow impingement, and we're going to talk about why that occurs in this video. So while throwing, what often occurs is athletes don't sequence their arm action properly, so they end up either not getting the ball in close enough to their center of rotation early in the throw, or they end up with an elongated lever arm where they drag the ball and drag their arm as they come through. And the important thing to consider is that based on the orientation of the baseball in three-dimensional space, our body will change or self-organize to try to accomplish a successful throw. What I mean by that is if my ball is positioned in the wrong position relative to my body is going to compensate to complete the throw. One of the common things that we see is that athletes either they don't get that ball in, or they wrap it out and around and they slam into that elbow extension prematurely. So their elbow gets full extension before they actually release the ball. And so what happens is they jam their elbow into the end of their elbow extension. And it's something common that we see, and it's often exacerbated by an elbow that's unstable. And what do I mean by that? I mean an elbow that has too much play in that UCL, or that's positioned in an unstable position so that joint has more give, and you get a windshield wiper effect of this bone into this little groove because there's a hook here that sits into a little concavity. When you get this windshield wiper effect, it either pinches here or here. And then you get bone spur formation and a whole host of other conditions that are actually the result of having poor positioning when that maximum stress is applied. So if your ball is too far out and around, and you wrap out and around and kind of supinate this way as you come through, that's going to lead to excessive compression inside the elbow. And you can see with some of these videos that we're looking at here, when somebody does cast the ball out and around, they actually lead to compressing that elbow, or if they slam into elbow extension before releasing the ball. And an easy way to see that is, does your elbow reach full extension before it gets out in front of your front foot? So if you come here and cast it out and around and slam into elbow extension, you're going to end up cramming those two bones together, and over the course of time, you're going to develop some spur formation, some pain in the back of the elbow, and that's where we have to go into some of our interventions, both from a stretching mobilization perspective and a strengthening perspective, but also some mechanical alterations so you don't end up with that again. And that's what we're going to show you guys in a future video. If you guys liked this video, found it informative on why you're dealing with potentially some of the things you are dealing with, make sure to subscribe and hit the thumbs up. We'll see you guys in the next one.